We did a research and the findings show that anxiety is a problem a lot of students here at BCC are faced with. Now, I'm going to ask you a question. What's your name?
Rebecca.
Rebecca. What opportunities could Bunker Hill Community College offer to students to cope with educational-related anxiety?
That's a great question. So one of the first things that we do is we have the advising center here, and we certainly talk with students about some of the stresses that they might encounter. This time of year is a really common occurrence for students to be coming in, dealing with some anxiety because finals are coming and grades will be posted and people are thinking about transferring. So we can certainly help you with those kinds of problems. And if we feel like that it goes beyond sort of the scope of what we can help you with here, and you might need some mental health counseling, we have people that we can refer you to on campus and then also in the community. So we have 2 senior academic counselors at Bunker Hill, Sarah Satham and Citrina Doughton, and they're both trained to help kind of identify students that have more intense issues or something like more extreme anxiety that might need to start seeing somebody in their community through their healthcare provider so they can help you get connected with those resources. But we also have other activities and events on campus, like for example, the nurse's office is going to be holding some activities around meditation and self-care and things like that to help students manage anxiety a little bit more and the stressors of being a student and juggling multiple responsibilities. I also think from my personal standpoint, I know that exercise is really good for anxiety and helping with that, so sometimes I'll encourage students to visit our health center because we do have the gym there that students can use for free, and we have athletic spaces like the open gym for basketball and stuff like that students can get involved with, and those are really usually good for anxiety as well. Students can also take advantage of activities on campus where they can meet friends and just having some peers around can be really good. And then sometimes just getting tutoring, making sure that you're meeting up with your professor, all things that can help alleviate some anxiety that you might be feeling, especially if it's particularly related to your academics and your classes.
Yeah, very good. That's actually very good. Okay, is there anything you want to say?
What's the worst case of anxiety that you have seen in students here, like in terms of affecting your school or performance?
I mean, a lot of students come in and have a lot of anxiety symptoms or are starting to experience panic attacks and things like that around finishing school or approaching exams and things like that. So that's not too uncommon. I guess the more severe cases I've seen are students who've maybe struggled with some mental health issues in the past, and then being in school and all the stress that can induce has proliferated those experiences or those symptoms for them, and in that case that's when we usually need to refer a student to seek medical attention or mental health care attention because it's beyond what we can really provide here at the school. But school can be a great place to come to, but it can also be very stressful. And for some students who maybe have struggled with mental health problems in the past, or maybe have just a lot happening going on in life, that being in school might just kind of make it a little bit unbearable and make those symptoms a little too extreme. They should definitely get some help and get some assistance. And if they don't know where to go, we're a good place to start, and we can help you figure out how to navigate finding the services that you need.
Yeah, so what do you think causes anxiety? What do you think causes anxiety?
Well, I mean, I think that it's multidimensional. I think that there's biological components to it, and that can make people more prone to experiencing symptoms of anxiety. But I think it also has a lot to do with what's happening in your life and your social environment. It has a lot to do with the way that you take care of yourself and coping mechanisms that you've learned over time. And sometimes they're effective and sometimes they're not. So if you're somebody who's prone to experiencing anxiety and then you don't really have those skills to help you cope with them, then I think you're probably more likely to experience it. But that's when it becomes problematic. Everybody experiences anxiety. This is a natural human reaction and instinct that protects us and has some positive aspects in a lot of ways. Like, anxiety helps us keep safe and it helps us make wise decisions, because if we're not nervous about something, then we'd be more likely to do it. So anxiety is normal to a certain extent, and there are ways that you can try and manage it to make it bearable, but if it's becoming something that's unbearable and something that you're really struggling to cope with, then anxiety becomes really a problem. So if you're experiencing some anxiety because it's finals and you're working on projects, it's not necessarily an abnormal thing. Like, you don't have to worry like, oh my gosh, I have an anxiety disorder. But if it's really interrupting your quality of life and making it difficult for you to enjoy or do other things that are important to you, then it might be time to talk to someone about managing your anxiety. And for some students, it might be as simple as just getting some more exercise, eating a little bit better, managing your time so you're studying in a smarter way, and getting some extra help so then you feel a little more confident going into writing papers or doing your exams. But for some students, it might mean that they need some more professional assistance.